Hey everyone, it's Michael here at Home Health Success Academy, and what I want to be able to share with you guys is one of the different pillars that you must have in creating a successful agency, especially when it comes to marketing your company. Now, one thing I really truly believe in is education-based marketing, okay? Education-based marketing is one of the most important things that you as a marketer, as a company, must be able to do in order for you to be able to do what? Have the attention, gain the rapport, gain the trust of these potential referral sources, and have them start referring patients to you to increase your census. So let's go ahead and start talking about education-based marketing. Okay, so the purpose of the buyer education is to create brand loyalty, right? A large and loyal following of customers who automatically come there first. Our goal is to be able to look at a referral source as a person that wants to buy our services. They're not paying for our services, but we want to look at them as a customer, as a potential buyer. Just pretend, let's say that you have a store and you're trying to sell candy. You want this person to choose your store to buy candies from you, okay? So you have to understand, people will pay, or we'll just say refer patients more if they perceive there is a greater value or deeper reason for buying from one provider over the other. If they see that there is a greater value for them to refer patients to your agency, they're going to choose your agency. Whether you accept the insurances that they actually need, because they have some patients that unfortunately are Medicaid. Do you accept Medicaid? Do you have they have patients who are HMO patients. Do you accept HMOs? What can you guys do to provide value? Let's say, for example, you are an agency, your star rating is high, and you have a low percentage of readmissions to hospitals. Hospitals may want to work with you so that they don't lose any money, because if patients return to them within those 30 days of discharge, they're going to lose money. So are they going to see or is there a perceived value that they can look at your agency and say, hey, I really want to work with this company? If most of your referral sources are not experts at what to look for in your product or services, this right here opens a gapping strategy opportunity for the brilliant strategist to capitalize on. These are things you can really capitalize on. Are they familiar with readmission rates? Are doctors aware of, the care plan oversight, G codes, that you can actually help them bill more money that they're leaving behind? A lot of doctors are not familiar with the G codes for the care plan oversight, so their billers are not actually billing for the services that they're providing for the clients that you're servicing at home. So if they're not knowledgeable about these things, by you providing the value, the education, this right here is going to increase the chance of them wanting to work with you by seeing your company of higher value compared to the other agencies that are just taking those referrals, okay? So who is the ideal person in your audience? This is something that you guys need to be able to, first of all, make sure. Who do you really want to reach out to? If you are in a hospital, your social workers. If you're in a nursing home, you want to reach the discharge planners, the social workers as well. Even maybe the administrator, because you need the administrator to give you a nudge, give you that referral to the social worker for them to start working with you, right? So you need to find out is who is in your stadium, right? To be able to create that stadium pitch. And you can't have the same verbiage. You can't have the same marketing strategy for a hospital, to a nursing home, to an assisted living facility, to a physician. And even with physicians, it changes. Your marketing strategy is different for a general practitioner, to an ortho specialist, to a cardiologist, to a respiratory, specialist. Each one of those have different marketing pitches. And so you must first recognize who you're marketing to, who's going to be in front of you. If you say, I'm here to tell you why we have the greatest office equipment in the world, right? If you're trying to sell office equipment, let's say, right? If you say, I'm here to tell you why we have the greatest office equipment in the world, you're going to have 90% of the audience leave, right? It's like you saying that we have the best nurses, we have quality nurses. Our agency's been around here for 10 years, right? You're talking about yourself, Nobody really wants to hear about you at this moment when it comes to marketing. Okay, because when you start talking about yourself, what value are you giving them? So this particular approach of offering some education of value to them gives you a significant opportunity to attract more buyers and build more credibility and start getting more of these referrals from these people. Okay, so you will attract way more referral sources if you are offering to teach them something of value to them than by trying to sell them your product or your service. And this is the biggest mistake that a lot of agency marketers are making and why they're struggling. These are why a lot of agencies are only getting 30, 35 patients census average a month instead of getting 100, 150 to 200. Offering an education that helps the buyer is going to get more buyer interests. So what are the things that you feel that you can educate a potential referral source? If the information is actually good and useful, it automatically repositions you in the mind of the buyer as much more of an expert than your competitors. Okay? You're teaching them things about their own business that they actually may not even know. So one thing, for example, I always make sure I pay attention and I read things always. So are you guys aware, for example, as of today, which is what, November 5th, 2018, that CMS gives telehealth a nudge with coverage for virtual check-ins? So what happens is there are changes that you can actually is going on regarding virtual check-ins. So this particular topic I saw online, and what I did is I created an educational-based marketing material printout that has my logo, my information, and then I can go to a physician and say, hey, doctor, are you familiar with virtual check-ins now? Check this out. Maybe this is something that would be valuable to you that you should start actually doing, for your patients. That's going to be able to hopefully, give you ideas to be able to market your company correctly. And what we're doing is we're educating them. And you need to always pay attention to a lot of different trends and techniques. Are you guys even aware that CMS is slashing clinic visit payments? Okay, so right now, this is an important information that you can actually give to physicians as well. Okay, are you giving them the idea of the care plan oversight? Are you telling a physician, hey, doctor, just to let you know, for every patient that you're taking care that you refer to us, we're going to give you a monthly printout to be able to make sure you're aware of the care that you're giving that you can then give to your biller to make sure that they properly bill. Because most doctors that we work with, before they started working with us, they were leaving about $10,000 a month not billed because they weren't informed what they can actually bill for. And I want to be able to give this to you so that it can happen. Because most of the time, as the billers working for physicians are billing for the services that are occurring within that physician's office, not what's happening outside that, which is the patients being taken care of at home. So that particular information and training that I give physicians, I have gotten a lot of referrals because this is something that I've done with physicians. If you want more information about the care plan oversight for physicians, let us know. We definitely want to be able to help you guys out with that. So when you sell, meaning when you're pushing your services, when you're saying, hey, doctor, give me patients, we provide quality care, we have 24-hour on-call services, you're going to break rapport. If you become salesy and pushy right away when you meet someone, that right there is what's going to create a break in rapport and not get referrals. If you educate them, if you provide them with value, you start building rapport. You should not go meet someone for the very first time wanting a referral right there and then. I believe, because this has worked for myself and for a lot of people that we trained, is that I don't want anything from a potential referral source for 30 days, a minimum. The reason for that is I want to be able to build a relationship. Majority of the time is a referral source that gives you a referral right away within that first week. You may lose that person right away. Because think about it. You just came in there and he switched his mind right away to start using your agency rather than the agency that they were working with before. So either that agency he was working with before really created so much problems that he wanted to switch, but at the same time is, if you create problems and somebody comes in the door right away, guess what? He's going to switch right away as well. So my job is not to just get referrals for the agencies I work for, but to create relationships for the referral sources so that we have a relationship, a friendship, a trust, so that we can start caring for each other. You need to be able to train every one of your marketers, every one of your salesperson with a massive amount of information. You need to list your strategic objectives for each. What would make you more respected? What would position you as an expert in the eye of the buyer? You want to become the funnel, right? Think about a funnel. You want everything to go through you. A physician has a question about, a client, does he really need home care services? You can answer that. Does a social worker at a nursing home, need ideas or has a problem with DME for a patient? Can they contact you? Can you solve that? Yes. You have a hospital. They have patient with a different kind of insurance. Does your company accept those insurance? If you can, you're then solving that problem. Can you actually be the funnel? Now, you're a home health agency, but you have a nursing home calling you saying, hey, we have a patient that needs hospice. You don't have hospice service for your agency, but you should have power partners that works with other hospices. Then you can say, hey, give me the information. I have a hospice agency that can definitely provide service for that patient. I'm going to grab that information and let them know about you so that they can start servicing you. Why do you want to do that? Well, guess what? The hospice agency you just referred a patient to, hopefully later on has a patient who needs home health services that they will then bounce back to you. It's about reciprocation and making sure you're creating relationships. Keep track of everything that you find when you're doing your research. Educational-based marketing materials, creating those educational-based marketing materials. If you see something online, can you put it in a handout? Can you then post it online as a blog in your website and then send that information to the people that you want to be able to get in touch with? What are you doing right now that you can provide education for? Most marketers, the reason why they're not successful or they are hitting a plateau where they can actually succeed more is because they are not providing educational-based marketing materials out there to be able to show that you have so much value other than wanting to take those referrals from these referral sources. So educational-based marketing materials is such an important thing. One thing that we show a lot at 10xpatientreferrals.com is how you can actually add programs, how you can add educational-based marketing materials for each programs that you have and services, and what you guys can actually do to solve problems for referral sources. That's why we're here. As an agency, our job is to be able to solve the problems of our referral sources. They have a patient who needs to go home, we can solve that problem. We can facilitate and make it easier for them. So you guys have to understand that's what we're trying to do here. And I hope that this is one of the most important pillars that you guys need to make sure you have in your organization. You guys can't just have a business card, a website, and a trifold brochure and expect that is the only thing that's going to get you referrals. You can't expect that just because you're going to bring in the donuts that you're going to get the referrals. It is not that way anymore, and we must have educational-based marketing materials in order for us to be able to differentiate ourselves from the other agencies out there. So once again, stop by homehealthsuccessacademy.com. Don't forget to go to 10xpatientreferrals.com. We provide every learning information that you need to know to be able to create a successful marketing strategy, get more referral sources, increase your census, and create that profitable agency for you. Okay, so 10xpatientreferrals.com is so important. Definitely give us a call, 863-333-6050. If you have any questions or want to be able to know more about our company. Always know one thing though, guys, that home health marketing is easy when you know what you're doing.